Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we're going to have Dr. Lawrence John. He's the president of the Pennsylvania Medical Society. We're going to do an update on the coronavirus and particularly physician burnout. But joining me first is John Micek. He's the editor-in-chief of Pennsylvania Capital Star. He's an expert on all things politics. We're going to get into the primary, should we have one. It's scheduled for April 28th, and a bunch of other subjects. As they say, let's do it.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, here we go. I want to hold these wipes up. This whole studio has been scrubbed clean, and we're keeping social distance. John Micek is way over there on the other side of the set, and the camera people are. We're very serious about this, keeping ourselves safe, and you keep the social distance out there, and we're going to try to keep the program on the air. All right, John Micek, you've been covering Pennsylvania politics for a long time, both in your current job and then at where? Penn Live.
And the morning call before that.
The morning call before that. That's exactly right. So before we get to how Governor Wolf and the Secretary of Health, Rachel Levine, are handling the coronavirus crisis, and it is a crisis, there's huge pressure now coming on the governor of the state, Tom Wolf, to move Pennsylvania's primary April 28th. As you and I speak, 5 states have moved the primary. Maryland has its primary on April 28th, Maryland, and they moved it ahead. So what's the deal with Governor Wolf and the primary?
Well, it's good to be here, Terry. I'm glad you're healthy. The guy who sprayed me down with Purell on the way in made sure that I was nice and disinfected.
Hopefully.
But yeah, I mean, you're right. So Maryland Governor Larry Hogan, a Republican, pushed up his state's primary April the 29th. It's the day after Pennsylvania's, in fact, to
I thought
June.
It was April 28th.
I think it's the 29th. Either way, they pushed it up to June. I think Louisiana did the same thing. There's been a lot of questions of Pennsylvania Governor Tom Wolf, whether or not the state is going to move up its April 28th primary, which is already ridiculously late in this very advanced cycle.
Right.
That remains something of a moving target. The governor says those discussions are ongoing. No decision has been made yet. Just this past Tuesday, Terry, we had a trio of special elections. One in Bucks County, 2 out west for openings in the State House. There's a lot of pressure on House Speaker Mike Turzai to postpone those contests. Those rolled forward over the protest of Democratic leaders. From what we can tell, everything went off fine. People made plenty of precautions. You can debate, I guess, the morality or the efficacy of doing that, and certainly that's something I'm sure that state leaders are taking into account. Keep in mind, as we sit here today, it's just about a month away. Right. Pennsylvania also has mail-in balloting, so there may be a transition to an all-mail-in primary. Who knows?
Yeah, I mean, I voted by mail. I mean, my wife and I got online. It was fairly simple to do, and you're exactly right. I think as the coronavirus increases, and it's likely to increase before it gets any better, I think the pressure will grow and grow immensely on the governor to move the primary date forward, so we'll have to see.
I should add, by the way, Terry, that bill that authorized the mail-in balloting, it's no excuse. It's zero excuse. You can do it. Previously, if you're a college kid living away from home, or a member of the service who is serving away from home, or another legit excuse, now anybody can do it for any reason at all.
Yeah, and who knows? We may end up ultimately voting by mail anyway.
Exactly right.
All right, Governor Wolf and Rachel Levine have holding literally, she's the Secretary of Health, daily press conferences, bringing us up to date on the coronavirus. We hear a lot about what's going on in Washington, with the president and his task force team giving regular reports. So give us an update on what Governor Wolf and Secretary of Health have been doing. I won't say attempting to do, implementing in our state.
Yeah, so I mean, our staff at the Pennsylvania Capital Star have been covering those daily briefings daily. They tend to be at about 2 o'clock. They were live in a room at Pima headquarters in suburban Harrisburg. For obvious reasons, they are now virtual. And much to the credit of the administration, I will say they've allowed us to submit questions remotely, which is really good. And I will credit Secretary Levine and Governor Wolf for their handling of this pandemic so far, have performed admirably and have been as transparent, I think, as possible given the constraints of law with what they've got. I mean, so Terry, I mean, life across the Commonwealth has changed dramatically. Pennsylvania state liquor stores are closed. Right. The governor has now imposed mitigation conditions in all 67 counties. That means all
non-essential stores,
all non-essential businesses, retail stores,
right.
Grocery stores and gas stations are staying open. The schools are closed. My daughter was learning remotely before I left the house this morning. The life as we know it is pretty profoundly shifted.
And colleges across the Commonwealth.
Colleges have sent their students home.
They're
as well.
on break. Some have literally closed their dormitories. I should, go ahead.
No, and we have a young woman at Temple University who writes for us, Michaela Butler. She was sent home. She'll be home for the rest of the term. There's some question of whether or not Pennsylvania public school kids will be going back at any point as well. Mayor Bill de Blasio in New York City has said the same thing. Governor Andrew Cuomo said the same thing in New York. Dramatically changed conditions. And, at times like this, Terry, it's really important to have a steady hand at the tiller.
Okay.
I mean, we could debate what's happening in Washington, but I'll give a lot of credit to Governor Wolf and Secretary Levine for being kind of those steady hands at this trying time.
All right, we're going to run to a break. We're going to continue this conversation. And also, you hear a lot about what physicians are doing, and it's a tough job, and they're under enormous pressure and coming down with the illness. And we're going to talk to Dr. John about that. But also, it might be interesting to ask the reporter sitting across from me what's going on with the reporting. How are they keeping up to date on what's going on and providing those of us in the retail market, I think is a good way to put it, with up-to-date information, and we'll get to that.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
All right, welcome back to the program. I want all of you to stay safe out there and follow all these guidelines about social distancing. That's a hard word. We're keeping social distance. How about that? John Micek is sitting across from me, and we're apart. The camera folks are apart. And the studio's been wiped down, washed out, however you want to put it, to keep us all safe. All right, John. State employees have, this has obviously affected all areas of our life. State employees, what's going on with them?
Yeah, I mean, non-essential state employees have been ordered to work from home if they have the capacity to do so, and I suppose they've been helped out if they do not. I mean, this one thing this does highlight, Terry, is there is a digital divide in Pennsylvania. Not everybody has access to broadband internet. Yeah. And that is a matter of some great policy debates.
And that's been going on before this situation.
Exactly.
There's a debate about rural and small towns without the internet or without,
access to high speed. Yeah, I mean, that's stuff that we take for granted.
Yeah.
That's in Governor Tom Wolf's Restore PA bill that's been kind of hung up for a long time. Legislative workers are working from home. The House and Senate came in for a hot minute this week. Passed resolutions that will authorize members to vote from home.
I was going to say that's
under certain circumstances. An unprecedented arrangement, but something that had to be done in recognition of these times that we're in.
Well, the same thing. There's a debate in Congress over it, particularly in the Senate, where some Senate staffers have it, and a couple of senators and House members are quarantined. They put themselves in self-isolation. I think that's the way to put it.
This morning, 2 members of the House have tested positive. United States Representative Matt Cartwright from up Scranton Way has also self-quarantined himself.
Oh, is that right?
He was exposed to somebody and is self-quarantined out of an abundance of caution. He says he's not suffering symptoms.
All right, we're going to talk with Dr. John in a few minutes about the business of doctors, the physician burnout, and the fact that many of them are getting the disease, whether they have enough equipment and clothing that protects them. Well, I haven't had any discussion with anyone, and I haven't heard any discussion at all about you all, you folks. How are you covering the important events that are taking place when you don't have the kind of access that you traditionally would have?
Yeah, I mean, it's forced us, I think, as an industry to rethink how we do our jobs. All of my staff are working remotely from their respective homes, and we have been for about 10 days now.
Right.
We've been, when the legislature was in, they were watching committee sessions remotely. They covered those very brief votes remotely.
Right.
A lot of telephone work, a lot of email work, taking advantage of the technology that we have. This is it's a people business. It's one of those jobs that depends on face-to-face contact, and it's made news gathering more challenging, certainly.
Mm-hmm.
But as I look around the state, the pages of all of our newspapers are filled.
Yeah,
television stations have stories on the air.
Yeah.
Journalists are out there doing the work.
Well, look, John, I want to thank you. Be safe, be well, continue to do your job. All right, Dr. John will join us, and we're going to talk about a lot of things related to the coronavirus and physician burnout. We'll get to that in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Cross-State Credit Union Association. Credit unions, where people are worth more than money. To find a credit union that is right for you, go to ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
Well, we're honored to have the president of the Pennsylvania Medical Society, Dr. Lawrence John, joining me. He's a family physician. So, Doctor, you're right on the front line of this, aren't you?
Very much so, Terry. I'd like to thank you for having us here today.
No, and we're keeping the social distance. I want to point that out. The doctor insisted, no, he didn't, but we would do that anyway. All right, so let's talk about this. Social distancing, we talked about that. We're apart, and the staff is apart here, the great folks who do the camera work and all the production. That gets emphasized and emphasized and emphasized. Take it.
It absolutely does. It's one of the many things we need to encourage people to do, along with other things. Certainly, washing your hands, very important. Using hand sanitizer, very important. These are things that help stop the spread of the virus, and we want to try to level the curve. This is what we're trying to do. What do we mean by leveling the curve and flattening the curve? We don't want everybody to get sick at one time. We don't want the illness to overwhelm the hospitals, the doctors, and the healthcare professions. If we can allow this virus to ease in and take care of people when they get sick, we can level the curve and not overwhelm the entire medical industry.
Do you have, I mean, you're a family doctor. You see patients all the time, and I presume you're doing a lot of telemedicine. Is that true? And by email? Explain that so the folks know.
Well, telemedicine's been around for a while, but this pandemic has really showed us how important it is. We are able to take calls, we're able to treat people over the phone, we're able to give good advice, we're able to reinforce what they should and should not do. And so telemedicine's been a wonderful new device for us to use to help, again, flatten the curve.
Yeah, good point. I tell you, one of the things that I find really, really tough is it's one thing to keep the social distance, and we practice that and we're all getting better at it, I hope. But you got so many members of your family. You got the kids and the grandkids, and you're seeing them. Many of them are in your home, and that's tough because you don't know if somebody gets it in the family. Then the rest of the family have to go into social isolation or whatever it is, quarantining at some point.
Well, we're trying to do nuclear isolation.
I like that term. Repeat that.
Yeah, nuclear isolation. If you can isolate the nuclear family and have the contacts be the same, that's very helpful. We want children to stay home, and we certainly want the population that's at high risk to stay at home. This limits their exposure. They're around the same people. It should lessen the transmission of this virus.
Yeah. So this has been repeated over and over again, but let's do it. Let's do it because I think it needs repeated, and that is the symptoms of the coronavirus.
Yes, the symptoms of the coronavirus, number 1 is sore throat, 2 is cough, 3 is shortness of breath. But one of the things we're adding to qualify people for testing is travel.
Yeah.
If people have traveled outside the country, this really helps necessitate the need for testing. Now, we all know this is flu season, this is cold season,
you're going to get a fever,
this is allergy
addition,
season, so you may have a cold, cough, sore throat, but the fever is the thing that really makes the difference.
Right.
And if you have a fever above 100, 100.5, you should call your primary care physician.
And I've read this that in older folks, the fever doesn't get as high as it does in younger folks, where the fever can get way up there, 103. So even a slight fever could be potentially a problem. Am I right or am I wrong?
Well, what you're pointing out is that older people, particularly compromised older people, sometimes cannot mount a fever. And so you're right, they can have a blunted fever, so it may not go as high as young persons.
All right, well, let's run to a break. When we come back there, there are enormous challenges facing doctors in hospitals, doctors and staff at hospitals coming down with the disease. There's something about burnout that we ought to talk about, and we'll get to those in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, the future of long-term care.
Welcome back. Well, if you're just joining us, my guest is Dr. Lawrence John. He's the president of Pennsylvania Medical Society, and we're doing an important update on the coronavirus. And we're now going to get into, we're going to have a chat about the physicians and nurses and other hospital and physician assistants who are working hard to keep us safe. But before I do this, I think we're all under additional stress. All Americans are under, and folks all over the world, because you don't know where you should go. If you go, what you should do. I mean, we know about hand sanitizers, right? We know about other ways to keep us safe. Wash our hands 20 times a day for 20 seconds. I think I got that, or 10 to 20 times a day for 20 seconds. But the anxiety level among Americans is through the roof.
Well, Terry, you're absolutely right. And I think all of Pennsylvanians and all of the nation is under a tremendous amount of stress. The coronavirus has added another layer of stress for physicians. Physicians were prone to burn out before the coronavirus hit, and this has added even more stress. The physicians are trying to protect themselves, they're trying to protect their patients, they're trying to protect their families, they're trying to provide care for their regular patients, and this has added an additional stress that it's been very hard for us to sort out. We do have a...
you have a graphic. They'll put it up as we talk,
that sort of lays out all the stresses that physicians are under. As you can see...
Here we go. You want to talk about a couple of them?
Sure, I will. As you can see, there's too many to look at one time, but the electronic health record is a big issue. Transparency in the office notes is a big issue. Patient satisfaction is a huge issue. Online social media feedback is a large issue. Quality measures is a large issue. So we were dealing with all of these things before the coronavirus. Now we're talking about things like protective gear, masks, getting patients tested. Patients want to be tested. We don't have enough tests.
Let me stop you here. Are you hearing, I hear in general in newscasts that there's this concern about having protective equipment and it's not available. What's the story there?
Well, everybody was wearing masks, and there was a run on masks, so there was a shortage of masks. So we're asking the population not to use masks right now so that the medical folks have enough gear to use. We need face masks, we need regular masks, we need 95 masks, we need total body gear. And all this stuff has been back ordered and is in low production. So the government has been wise enough to release some of this into the medical field, and now the supply is improving significantly. But this gives us a sense of security that we're now be able to protect ourselves and our patients even more.
Yeah, one of the interesting, now you're a family doctor, so your office gets a call, somebody thinks they have the problem, and they shouldn't, it's my understanding that if you think you have, if you're symptomatic, I'll put it that way, you should not run to a hospital, you should not run to an emergency room, because if you want the test, you're to call your local physician and let the physician coordinate the test. Once the physician gets to talk to the patient to determine whether they're, whether they have symptoms, not allergies again, and not some other kind of problem, but they symptomatic for corona.
You're absolutely right. We want the patient to call the office, not to come to the office. If the patient meets the criteria that would suggest that they should be tested, we then call the testing center, make the recommendation, and the testing center makes the final decision as if the patient should get tested. And
there's been a real problem about testing centers, and now it looks like they're full bore. They're going out to expand those, but most of them are in areas where there's a large number of patients that have already been tested for the virus itself, correct?
Well, we haven't had a lot of testing up to now. There's more and more tests coming in, but we haven't had enough testing. In the next week or so, we'll certainly have a lot more people tested, and we'll know a lot more about the virus by the testing.
And we're probably to see an uptick in the number of people who have it.
Absolutely, that's for sure.
All right. Well, let's. You were on this subject earlier, and I think it's important. Physician shortage, and that. You've been on the program before, and we talked about that. That's been a problem before, and now it's only going to get exacerbated.
Well, hopefully physicians will be able to protect themselves, as will the nurses, and so there'll be enough people around, hopefully, to provide the care. Again, if we can keep the curve flat and not allow the curve to bend up, and if we can make sure that this virus doesn't hit everybody at one time, then it will be a great benefit to the medical profession to be able to have enough people to take care of these sick folks as they appear.
And I guess we'll have to see what effect this has with the way education is being provided on the ability to turn out physicians.
Well, yes. A crisis like this, I think, heightens everybody's awareness of the dedication and devotion that physicians need.
Well, look, I want to thank you for coming on the program, and be safe and be well, and good luck to your patients.
Thanks for having me. Appreciate it.
All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.